Christ Hospital Health Network is hosting a free webinar, and you can join it on women's orthopedic health. Dr. Jennifer Chung in studio now with us, telling us all about the event, and we are covering women from head to toe. So let's start with the head, because I know that is one of your specialties, and headaches.
Yeah, I mean, so we know that it disproportionately affects women for various reasons, namely hormone changes.
Yeah.
So there's a lot of treatment options. The biggest issue is determining what the primary cause is, because there are various causes to headaches.
Can it be an issue where it's a joint issue and it's impinging on a nerve and that's traveling up and giving you the headache?
Absolutely.
Or is it something else that's neurological?
Yeah, no, absolutely. It could be cervicogenic or stemming from the neck. It could be muscular, myofascial, related to the posture. And so all of these things we will broach upon on this webinar.
And women's bodies, especially after having children, everything changes with your hormone levels, right?
Absolutely.
And it keeps changing as you age. So you may develop things to wonder, why am I keep getting headaches? Is it something I'm eating? Is it something I'm doing differently? Am I sitting like this at work? Am my neck's all hunched up?
Yeah, I mean, it really could be all of those factors, but we do know if you're entering perimenopause or menopause, that those fluctuations in hormones, that we do often see flares and headache episodes.
Okay, let's talk about, as we move down the body, moving from the head, what's the next area you're going to focus on?
So we brushed on the neck, so we'll talk about the neck, and then we do talk about peripheral joints as well. One of my other colleagues will talk about different orthopedic conditions that disproportionately affect women, and then all the way down to the feet, where we talk about plantar fasciitis and other foot issues that women see.
It's interesting. I know a lot of girls I ran with in high school and college. We all competed in track and cross country. Some of us have had no problems, but others, their joints hurt, their knees, their hips, their ankles. And so you can address all of that in this webinar.
Absolutely. We do know that your anatomy, the differences between the genders, there are different things that will predispose you to different conditions.
Those aches and pains.
Absolutely.
So we're walking fearless. That's Monday, April 14th. You can scan the QR code to register. If you're not quick enough with your camera to get the QR code scanned, where can we go to get some more information?
You can go to the Christ Hospital Network or any of our social media platforms.
That's awesome. Dr. Chung, thanks for coming on. And hopefully you guys get a good turnout on your webinar, because I'm sure there are a lot of women who maybe they're busy, don't have time to leave the house, but they can tune in.
Absolutely.
And that's always a great way to get some information.
Absolutely.
I love telehealth. It's so good.
Great.
Thank you so much.
Thank you so much.
Have a good weekend.
Thank
Be careful on the roadways.
You too.
All right, let's get out to